The work that I was taught 27 years ago now, myofascial release, was always done directly on skin, and there was a lot of reasons why it was said to be necessary to do it on skin, but I've moved away from the need to work directly on skin so often and so frequently. In fact, sometimes it's actually, I think it's more advantageous to work over clothing. The person's modesty is valued and honored in that way that a person might not feel comfortable with themselves with me demanding that I work on their skin. There's other times from a social or personal perspective that a person doesn't feel safe with me putting my hands in certain parts of the body or certain areas. One place could be right in the chest, and that could be for a variety of reasons. And rather than me forcing my agenda or my needs to do it on my patient, I'll often give them the sense, that respect, that it's okay. In fact, why don't you put your hands here and I can work directly through your hands. So for instance, when we're doing work to the sternal region, if Melissa did not feel comfortable with me putting my hand directly on her chest, she can bring her hands up and from a little, I call it shielding, right? She can put her hands there and shield that personal contact in the space that she may not feel comfortable with me putting pressure. And I can work very easily through her hands like that. If we were working in the area, for instance, post-radiation of anterior cervical, the neck region, and the skin is just too tender, too uncomfortable, painful, whatever that might be, for me to work directly on her skin, in a lot of patients, even though they have tenderness, if they put their hands there first, it's a bit of a barrier. They have a sense of self-control where, go ahead, put your hands up on your neck area and let your elbows just drop. And I can do a lot of my work right through her hands. It gives her a sense of control. She can even resist me if something feels too strong, too much, too painful, or provokes her in any way. Gives her a sense of safety that over time she may not need to feel like she needs to have her hands up like this. Or maybe we just end up spending the entire number of sessions doing it like this. It makes a little difference.